What's going on, guys? It's Dr. Mike, physical therapist. Now, if you recently had a knee replacement and you feel like you are falling behind with your rehab, then stay tuned, because in this video, I wanted to show you some of the top exercises that you can use to help improve your flexibility and increase the strength in your knee. Let's get started. Now, the focus of this video is to provide you guys with some progressive exercises that you guys can use once you're past the 2-week mark from recovery. Now, if you haven't done so, check out the previous video that I made that discussed some of the top exercises that you need to be working on right after surgery. I'll make sure to link that video in the description below. Now, as we know, one of the major goals after knee replacement is focusing on our range of motion. So I wanted to show you after the 2-week mark some of the top exercises that I still love to utilize to help regain some knee extension, your ability to get the knee straight, and to help regain knee flexion, your ability to bend your knee. Now, one of the top exercises that I absolutely love, and I showed some of this in the first video that I created, is simply a terminal knee extension, but sitting, okay? A lot of people that you see will be working on this laying down in their bed, but when you are sitting up, it really changes the position of your pelvis. And now when you prop your foot up on a stool or a chair like this, there's no way that you can cheat on this exercise. So notice most of you guys will probably look something like this, where your knee is slightly bent. But what's happening here is gravity is naturally pulling that knee down into extension. And what we're focusing on is really lengthening the hamstring and the calf muscle. And you're just gonna hang out here for up to 20 minutes a day. Now, that might sound quite aggressive, but keep in mind you are breaking this up in small sessions. So whether that's 2 or 3 minutes at a time, whether that's 5 minutes at a time that you can tolerate, this is gonna be one of my top exercises to really help restore that knee extension and really get that knee straight again. We're shooting for 0 degrees of knee extension. That is normal range. Also keep in mind that when you do this, we shouldn't be slouching in a chair. You wanna make sure, preferably with the chair where your back is supported, is gonna be more comfortable, but you wanna make sure you're sitting up nice and tall and you're really feeling the stretch behind the knee, just like so. Now, if you really wanted to make this a little bit more challenging, a couple things you can work on is by placing an ice pack over the top of the knee. This is gonna add a little bit of load or a little bit of weight, which is going to pull that knee capsule downward towards the ground. Also notice that the bench or the chair is not supporting behind the calf there. It's actually further closer to the heel, okay? What's going to happen is you're going to feel more of a stretch back here. There's going to be less support on the lower leg here, and you're really going to focus on lengthening those muscles and tissues behind the knee there. I've also had some individuals that are very flexible and they may feel very little stretch with this exercise here. Another last tip that you can work on with this exercise is by sitting up nice and tall and kind of working on a gentle rocking or hinging forward at the hip. You're really going to basically put that hamstring on stretch, and you might even be reaching forward just like that, okay? Once you have full knee extension, and the one way that you can compare one side to the other is I love using the non-operative side to compare what does your surgery side look like compared to your non-surgery side, and that will give you a guideline of what your normal range of motion looks like, okay? So we've talked about how to get the knee straight. Now we're gonna focus on improving knee flexion, which is your ability to bend your knee. And what we're shooting for at the 2-week mark, we should be shooting for trying to get up to about 100 degrees of knee flexion. So if we look at knee flexion, we have 90 degrees. We should be trying to get past that 100 degrees at the knee there, okay? And that can be very challenging for people. Most of us at this time are still probably working on heel slides in the bed, which can be very difficult. In my first video that I created, I provided you guys with a few other exercises that you can use to help bend the knee that can be very successful. But with this exercise, I'm gonna also review the scooting forward technique. Now, you're gonna do this supported by a chair. This is very helpful when you can actually use a chair that has armrest. I'm using just a box here. This is what I'm working with right now. But what I'm gonna do is I'm gonna first, if I'm just sitting, I'm gonna slide that knee backward first, and then I'm going to slowly scoot my bottom forward. Now notice as I scoot forward, I'm not standing up, I'm still sitting in my chair, but shifting my weight forward, requiring more knee flexion at the knee. Then I'm gonna hold it there at end range as far as I can tolerate for about 5 seconds, and then I'm gonna slide that back, okay? Once again, you're gonna slide, kind of like a heel slide, but in a seated position. Then you're gonna hold on to the chair or something that's secure, and then you're gonna shift forward, allowing that knee to bend there. Now keep in mind, I'm sitting on a surface where my hips are above my knees, which is gonna be easier to start with. If you're sitting on a very low chair, this is gonna be very difficult because now your knee's gonna look more like this. So you wanna be on a chair that's high enough where you can create some leverage with your body weight by shifting forward into the chair like that, okay? Now that we've addressed the range of motion component, now we're moving on to some exercises that are gonna help regain and recruit the quadricep muscles again, which is the major muscle group of the front of the thigh that is gonna support the knee capsule, especially when you're standing. So it's gonna be extremely important that you learn how to efficiently recruit all the muscles of the front of the quad in order to be able to accept weight and walk on that knee normal again, okay? So in my first video, I mentioned going over a quad set where you're just tightening the thigh and your leg is not moving. We call that a quad isometric contraction. And then once that gets easier, you start working on a short arc quad, meaning there's a pad underneath your knee, and now you start to get some motion as you are recruiting the quad muscle. So the next exercise, if those become too easy, another progression you can use is the leg extension. Now, preferably you're doing this with your feet hanging off the edge of the bed or hanging off a chair, and the back of your thighs are gonna be supported here. Now, what you're gonna work on is now recruiting and squeezing the thigh muscle. Notice also that I'm gonna start to bring my toes up. It allows me to get a good contraction of the quadricep muscle. And then I'm gonna lower down slowly with control. Some people you'll see, they'll just kind of kick forward and they let their leg just fall down. We want that eccentric control. It's your ability to control that contraction, nice and slow on the way down. Here we're focusing on about 3 sets of at least 8 to 10 repetitions. We want nice and control. Some of you might start off with just working on a shorter range of motion, but as you gain more control of that quadricep muscle, you're gonna realize that it's gonna be easy to fully get that knee straight again, okay? So you're pulling, extending the knee as far as you can go, and then you're lowering down nice and slow, okay? Now there are some occasions where the leg extension is actually too easy for people. So a step up from the leg extension, if you have good control and you're able to fully extend your leg out again, now you can start to incorporate your hip flexors and the entire quad muscle. This is gonna be extremely challenging, but this is gonna really facilitate the quadricep muscle and help increase the strength in that region, okay? So now you're gonna perform an isometric contraction, and now from here, we're going to keep our leg extended, and we're gonna lift the entire leg up. Notice I'm having a little bit of shaking while you do this. This one is definitely gonna be easier laying down to start with, but I'm performing this sitting up here. Once again, you're squeezing that quadricep muscle. Once you've activated that muscle, you're slowly lifting it up, nice and slow, and then bringing it down. So we've addressed the range of motion component, and we've given you exercises to help improve the strength in your knees. Now we're gonna focus on a few manual therapy techniques that you can use to continue to help improve the mobility around the knee. One of the ways that we can help improve range of motion without bending or straightening is actually working on some patellar mobilizations. Now this is a technique that you're gonna use to help move the patella, which is the kneecap, laterally and side to side. So to have a healthy knee joint, you should have the ability to not only flex and extend the knee, but also that patella has to have the ability to glide laterally freely, up and down, even in diagonal directions. I've also made a video on how to perform this correctly, but I'm gonna review here is you're gonna grab a hold. I like to use my middle finger or index finger with my thumb, and I'm basically getting a hold of that kneecap, and you're gonna feel the bottom of it, also the top, and you're gonna be gently just kind of shifting that kneecap side to side. And some of you might feel like, I don't really feel much. If you take that other knee and you feel the amount of movement and mobility that you have along that kneecap, you're gonna realize very soon how much restriction that you have along that soft tissue. So I'll spend a few minutes here teaching people how to mobilize the kneecap very softly, going up and down, maybe even in some diagonal directions to help improve the ability for that kneecap to glide freely after surgery, okay? Also keep in mind that you might even be able to explore what the tissue feels like surrounding the knee, okay? So that may mean, working on some gentle massages in some circular motions, okay? Maybe even some cross friction where you're simply just finding areas around the knee that maybe don't move and are very tight. And you can spend some time working on some gentle, soft tissue to help get the skin over the knee joint to basically move. You'll be surprised what that can do when you start to free up some of that connective tissue and you start to free up some of that tightness. I've had a lot of people report that it actually gives them some pain relief because some of that pain is being caused by the skin around the knee joint just being so tight, okay? Now, the last exercises that we're gonna get into today that is gonna help you to regain function and strengthen that knee again is starting to focus on some weight-bearing activities, meaning that we're taking you from doing exercises from laying down or sitting to now standing. This is gonna help you learn how to accept weight on that leg again and really get you to start performing some activities that can allow you to start to progress to more advanced activities standing up. So the first exercise we're gonna get into that's really gonna help you start to feel confident on that knee again, because a lot of people right after surgery feel like that knee is unstable still because of the amount of swelling and the loss of proprioception that they had in the joint. And so they almost feel like it's unstable and it's gonna buckle. So part of the rehab is teaching you how to be confident and to know that that knee surgery is okay and you can accept weight on it fully again, okay? So we can start off with having you stand up, and the first thing you're gonna work on is, for instance, say my surgery leg is the left leg, you're gonna first work on just some gentle rocks going side to side. We call this kind of like a lateral weight shift. So you're feeling what it feels like to shift all of your weight to your surgery leg, and then you're unloading the leg. You're loading the leg, and then you're unloading the leg. So you're shifting side to side, seeing what it feels like. I'll even have some people get more comfortable, and then they're starting to bend their knee a little bit more as they're standing. Now you're doing this with an assisted device, whether that's using crutches. Most of us are probably going to be using a front-wheeled walker after surgery, and you're shifting your weight side to side. If you stand up nice and tall, you can really start to build some confidence, seeing what it feels like to really add more weight on that leg again. Now from this position, you can even start to progress the weight shifting to now lifting the leg up. Now this is taking you from basically weight shifting to now putting your entire weight on one leg. This is going to be the most challenging. When you do this, the longer you hold that opposite leg, the more you're spending time balancing on that surgery leg. And this is extremely important because now that we've started to get our range of motion back, now that our strength is coming back as well, we now want to focus on making sure your balance when you're walking and you're standing is good. And we can do that by focusing on a single leg balance while you're holding on. Obviously, using two hands is going to be supportive than one hand, right? So the main thing is you're getting comfortable with knowing how it feels to basically put all of your body weight on one leg. And this can be extremely beneficial for those of you dealing with balance issues or those of you just not feeling confident on that knee again. Those are some of the top exercises that can be extremely important after knee replacement. Now, if you found value in this video or you enjoyed watching this video, please give this video a like, subscribe to the channel, and if there's another topic or a surgery that you'd like for me to cover, I would be happy to do so on this channel. Until next time, I'll see you in the next one.